We've got a really distinguished panel of people up here, and we know each other from different conferences we attend. We always share ideas and stuff, so it's really good that we have the synergy of the different local health systems in Southern California, so we can learn from each other. I'm just going to go ahead and jump right in. We had these questions kind of came in earlier, and I talked to a lot of my counterparts across California and parts of the West, and we wanted to talk a little bit about some of the initiatives that we're working on, and so you can actually hear from multiple health systems from different levels and different responsibilities of how we're dealing with IT cybersecurity. So I'm going to jump right in right away. It has to do with preparing our workforce, the awareness that we're giving our workforce, because we know that the #1 threat of some type of cyber attack or breach is from our end users divulging their username or passcode. So I want to just hand it over to the panel. What are some of the techniques? What are some of the tools? What are some of the initiatives you're doing around IT cybersecurity awareness for your end users?
Sure, I'll start.
Okay.
I think this is working. So, can you hear me? I think so. Okay. Chris Joerg with Cedars-Sinai. So what we're doing is we're really focusing on phishing and phishing awareness. And phishing has been a threat vector that's increased significantly. Traditionally, phishing attacks that we've gotten a couple of years ago, even 18 months ago, were focused on a user clicking something and getting malware and getting their system infected. And what we're seeing now, much more so, is what Kevin had mentioned, that a user clicks on something, they get brought to a page that looks very legitimate. Actually, recently, we just got one that looks exactly like our login page for Cedars-Sinai, and then it incentivizes the user to click and put their username and password. And because they do that, if they do that, then that can obviously compromise their email account or any accounts that are associated with that username and login. So one of the initiatives that we've got from the phishing, as well as there's countermeasures I think we'll talk about later, but phishing awareness is huge for us.
Yeah, I would say the same for us. We're working with a company called Synergistic to do quarterly reviews, quarterly security reviews, which include phishing. What we do is we go ahead and we run the campaign. On top of the phishing campaign, we also do social engineering penetration tests, and then report those numbers out to Chuck's senior leadership team. That's probably our biggest focus right now. On top of that, we also make the employees go through, as part of their annual training, that used to be really just a focus on overall company policies and procedures. Now they're required to do a security training as well.
Thank you. What's been some of the results of the click rate that you're seeing, people actually clicking and divulging their username and passcode on a fake phishing?
For us, it started fairly high, to be honest. Once everybody got used to, at one point understanding that they're being tested, but at the same time being a little more vigilant. The numbers, Shri, you could probably share when we get to you, the numbers have gone down significantly. Same thing goes for the social engineering as well.
Okay, thank you.
Gary Ahwah, City of Hope. So education is indeed a challenge for all of us. And so it's ongoing. I think it's an ongoing challenge that we have to figure out what's the best way to educate our end users, become more sophisticated about this. So it's very similar programs we have in place, as the other two folks just mentioned. First is education. So as part of onboarding a new employee, they have to go through a compliance training specifically around security. And you cannot, essentially you cannot, it's a requirement for you to do that within 30 days of joining the workforce. The other thing we've done is around the phishing area, we've actually put for something very simple in emails so people know and warn them that this email is from an external source. And it sounds very simple, but we put highlight in red, this email came from outside City of Hope, because we find people who are actually clicking at things they shouldn't be clicking on are unaware. And it usually comes from folks who are not necessarily in the front line, but someone in the back office operations is actually doing this. And so that's more of an awareness standpoint, and we're doing the same program with you to figure out who is actually clicking on things they shouldn't be clicking on. But I do believe this is indeed an area that will continue to evolve. We need to do more. It's simply not enough.
Thanks.
At Loma Linda, I think the only CIO here on this panel, so I feel a little inadequate because these are really intelligent people here. So, security is just like one of the plates that most CIOs have to spin. But at Loma Linda, I definitely have to say it's really a cultural change for us. It's really been over the last 4 or 5 years, changing the cultural mindset of the organization that cybersecurity is really not an IS or an IT problem. It is really in an organizational problem. It needs to be embedded at the strategy of the organization, from all levels across the organization, from the board level all the way down to your temporary staff and your vendors and affiliate partners. And so takes a while to get that ship to turn, but we've been pretty intentional and deliberate about making sure that we're trying to drive that message throughout the organization. Obviously, at the center of that is really associate training and end user. So just analogous to what everybody else has already spoken to. A lot of stuff in the phishing arena in terms of where we do spearheaded campaigns. We had some real interesting numbers. Our initial campaigns kind of went out unadvertised, and we had some pretty high click rates on those, and because we wanted to see what our baselines were. And so now it's interesting to see the cultural change about having users become more aware about what they're doing. Much like Gary, just a few years ago, we put that big disclaimer at the bottom of all the external emails. So there's just another layer there to just let the people know that they are really our last line of defense.
Awareness comes in multiple ways. I mean, from our perspective, when you look at awareness as an overall scenario for helping people understand what is it that's happening out there in the world. People hear a lot of things about WannaCry or PChere or any of those things as well, apart from the phishing aspect of it. So when you're looking at those things, you have to help the end users understand that you are prepared, you are there, you are taking care of them. That's one thing that when I go down the hospital and do rounds, that's the question I get asked. Are we okay? Are we good? That's the question that we need to be responding, because that's our responsibility as folks in IT. So we've done a lot of things, as Adam mentioned. Phishing is one aspect of it, but newsletters, tips and tricks, people to understand it, especially when there is an incident. Then that's lots been spoken about. It's better to communicate to the end user audience about what's really happening. Are we protected? How are we protected? That helps reassure end users that we are good, right? That's one thing. The second thing which we've done, which has been very useful, also is go speak at various opportunities. So grand rounds, you take opportunities where physicians are looking for additional information and so on. So whenever there is a new security effort or a project that we're doing, go and communicate, sit down with them, with medical executive councils, help them understand what is it that we are doing. So that's another aspect. Third aspect is communicating to the stakeholders at the C-suite level, at the board, right? So we have an executive compliance committee where we communicate that as well. So you're covering all layers, right? I mean, you got to cover the layer at the top and also at the bottom. And there's multiple ways to communicate that down, and that's what I think is beneficial. So what we are trying to do is change the culture of security. That's more important, and make security part of the fabric. So today, when one of my CFOs or CMO or COO receives a mail that he feels doesn't work or doesn't look right, he forwards this to the street. We need to stop this. So that we get today, day in and day out. That is helping them as well as us to keep our protection. That is more important, because now your end users are becoming your guardians. That is probably the best way to do this for us.
Thank you. So one of the things, the challenges that each of us have in various degrees, whether it's the CTIO or the CISO or the CISO or the Chief Information Security Officer, is our patching cadence. And so we know the biggest vulnerability is patching our systems, usually tied into some departmental systems and so forth. So I want to talk to the group, but what are you doing around patching, patch management? Where's your baseline? And what are some tools are you doing to kind of decrease or increase your patching cadence from what used to be 40 to 60 days, now trying to get it down to 30 and trying to get it down into a week? Chris, you want to go ahead and start?
Sure. Yeah, patching's not fun. I mean, that's really what it comes down to. Nobody likes to do it. We need to do it. We saw with WannaCry and some other recent vulnerabilities that came out that we have to do it. I guess Equifax is a perfect example that's been in the national media. It's housekeeping, and what we're actually looking at, and we're very good around IT. We're getting better around IT and things that we own within the environment. At Cedars-Sinai, where we, after WannaCry, what we saw and what kind of became very, very in our face was that the medical devices and the medical device systems, we didn't have as good of a handle on those. So we're definitely increasing inventory and situational awareness of all medical devices and their connected ecosystems. And what I mean by that is not just the medical device that's attached to a patient or that's collecting information, but the operating system that actually manages those systems. So a combination of getting that inventory, situational awareness, and then also getting a much better relationship with the vendors that support those, because there's a lot of situations where we've got devices in our internal network that we don't necessarily own, and there's always been this premise of, well, if you touch it, it'll void the warranty, the FDA won't let us use it, and we're working with the vendors to say, look, there's scenarios where we have to patch this, what are those going to be, and how can we escalate?
Totally. So the best thing about WannaCry was probably the fact that it made the biomed folks realize that they needed to partner up with us, whether they liked it or not. And I think they also learned, at least from the technical side, that the vendor may say something and say, you can't do this, you shouldn't do this, but there's always somewhere in between, right? There's always something we can figure out. If we can't mitigate it with a patch or something like that, we can mitigate it somehow else. But I think we're accustomed to just hearing whatever the vendor had said and taking that as, the gospel. On our side, we try to automate the patching process as much as possible, whether it's client side or server side. And we've actually worked the process into our change control process that we follow every week. So every week, it's a standard presentation from the security group who presents us with the list of patches that are at a critical level. These days, they don't even need to explain why. We used to make them explain why. They don't have to do that anymore. If it's critical, we go ahead and move ahead and patch it. And we've seen a higher level of engagement from our vendors. The biggest challenge right now is probably some of these closer partnerships we're building with affiliates, because we don't necessarily have control over those systems, but they access our systems. So trying to find a middle ground with something a little more agnostic that isn't, let's say, Active Directory dependent or something along those lines, whether it be BigFix or what have you. Internally, we're leveraging SCCM, to do that type of stuff. So I'd say the affiliates are probably the next biggest challenge.
So any form of automation you're trying to deploy right now?
Yeah, from an automation perspective, everything's done through SCCM.
Well, I must admit, I'm not a CISO either, so we just look at the budgets and the numbers. But I should say, for us, this is indeed a challenge. So how often depends on the severity of the issue we're dealing with, but clearly within 30 days, we've got patching going on across the entire enterprise, and sometimes it's immediate. Some of our challenges has to do with instruments, right, back here. A lot of the instruments that are driven on servers, a lot of times get impacted by patching. As many of you probably notice and live this. We have operating systems that drive certain experiments in our research areas, that where did they get patched, some issue would happen. And so we've got to figure out a better way of doing this and a better way to create moats around those particular areas. So we're not necessarily, we work into a planned patching process. So in some cases, we require some extensive testing, so we don't have experiments fail. Those experiments could be extremely expensive, or they need to start over. So we're working through a plan about how do we do this in a much more planary way. In some cases, we can't. We know that. You have to do it immediately. By the end of the day, we get everything patched within 30 days, on a 30-day cycle.
Well, that's a good baseline to follow, 30 days. So I think historically, we've been very reactive to our sort of patch management. But, knock on wood, we have some really smart people, and we're trying to be a little bit more proactive about that. And part of our strategy around that is, as we've extended our clinical systems to other partners in the area, it has really taken us from a position of being sort of a sole integrated health delivery system. It's just our systems, just us, or maybe to now that we are supporting other organizations. And so there is definitely an added layer of responsibility that we sort of turned ourselves into sort of almost a vendor on some respects. And so definitely an increased awareness about that. And so going through our IS organizational structures, we've tried to look at resources and figure out where is it best where we can align these sort of patch management activities into the regular workflow of somebody, because we spend a lot of time in, keeping the lights on, and we didn't do a lot of the stuff to keep the vehicle moving down the road. And so trying to build that into someone's regular workflow, where it's just not a reactive approach to it, but where it's a defined function that they do at a particular time every single day, and it's always being constantly monitored.
So when you look at patching, I run the application side of the house for UCI. So we are the folks who get into a situation where something doesn't work, we get penalized by our customers. So we have to be more and more careful about these systems that really are susceptible to patches that don't work for them. I'll give you an example. The lab's information systems are very susceptible to something like this. So if something doesn't work or something happens when you're doing patching, we generally tend to get the first call to make sure what's going on. So we have to be extra careful. So what we do is work with the Adams group and make sure we can get the patching done in a way that there's no harm to our end user population.
Unless I'm mad at you, and then
unless you're doing that, yes. but it's interesting how the whole concept of patching is only considered from an internal perspective. Even if you're in the cloud, patching is important. Make sure that your vendor is patching their systems and servers. That's something that people don't consider almost all the time, right? So they think, well, I've given it to vendor, he should be taking care of it. But not all the time they do that. You need to have controls in place to make sure that they do that too. So if you look at internal patching, yes, you can have a process and manage it and whatever. But also external, if you have a third party managing your environment, that's also an important factor to consider.
Thanks, Ree. The other thing I just want to kind of move on is there's some questions that came from the group prior to this meeting was how much is too much or how much is not enough in your IT spend for IT cybersecurity initiatives and or programs, both from a capital and operating perspective. Could you just kind of walk through that? I could start it off for MemorialCare. We look at our total IT budget and we see how much we're spending towards that on IT cybersecurity. We're spending about 3.5% of our IS budget is attributed or is associated with IT cybersecurity. And then from a capital perspective, we're always looking at the next initiative. Fortunately, we really have a good, strong administrative team that's helped us get more funding for IT cybersecurity. So maybe just step through the funding mechanism, both from a capital and an operating expense. Or you think you're spending enough on IT cybersecurity?
Sure, I'll start. So we're at about that same percentage in the 3 to 4% range from a spend. Certainly, we've had a significant shift in the past 2 years. We were heavily capital before, and we're now, 85% operational. And that's due to the trend in the cybersecurity tools. They're either SaaS-based or SaaS availability, which we're going towards in the cloud, or they're a software subscription. So a lot of the new tools that we've got, they've either, just capital doesn't make sense for us, so we're really just starting to do the subscription model. And then the other piece that we run into, is that we're very, very conscious about not doing tools overload. We don't necessarily always spend the money that we get. We're conscious of saying, if we're going to deploy a tool, we're going to bring it up and running. We're going to make the best of it and make it work operationally efficiently and get actionable information from those tools. And what we don't want to have is shelfware. And we spend a bunch of money. There's a perception, which is usually the worst case, a perception that we're being protected by a particular software. And if it's not configured right and running, well, then bad things can happen. And the Target breach, that was really what's kind of that scenario with them. Is that they had actually had millions of dollars in security software. They had a great logging technology that was supposed to have alerts, but their team behind looking at those alerts wasn't robust enough, and they didn't see the actual, the alerts before the bad things started happening.
Thank you.
I'd say for the most part, the spend is pretty much on par with you guys, and we are also seeing the shift to more of an OpEx model. I think our biggest challenge when it comes to new spend, let's say mostly CapEx, is that a lot of the products that we're seeing come in, they do a lot of the same things, but offer that one thing that the other products don't do. So I think we see ourselves running into a lot of challenges with either overlap of, or maybe too much of a clampdown of the environment, or trying to decide which product is going to provide that service for us in the environment. And it's becoming, I think, and Shreya, I'd like to hear what you have to say too, it's becoming harder and harder to make decisions on these capital products or capital projects or capital purchases, because we look at a product and say, well, this does 5 of the things this widget maker that we already have does. It just does this one extra thing. Do we really need that? And then you run into the challenges of trying to rationalize that with either senior leadership or executive leadership. I'm very happy to see things moving down the OpEx path, because you don't get as much of that overlap in a SaaS model.
It's interesting how when you look at capital, we spent, initially when we got there, I think thanks to Chuck, we spent quite a bit of dollars trying to get the security posture shored up in the organization. There was a lot of capital spent a couple of years ago just to make sure we were doing the right things. Now it's all becoming more and more OpEx spend, because that's where we are today in the cycle. So various organizations go through those capital and OpEx spend cycles. I think from a security perspective, the capital spend is always going to be there, because the threats are constant, right? And they are changing in a way, right? The threats are changing. There are new products that are going to help mitigate some of the risks. Some of the older products will get, kind of obsolete in some way, shape, or form. You get new threats, new products to manage that. It's going to be, and from a security perspective, it is definitely a different environment today than what it was 3 years ago. And then you include medical devices and the capital investment you have to make to make sure that the medical devices are segmented in a way that you can manage them to move that forward down the path. It's a lot of spend from a security perspective to keep up. And I think that is something that we've highlighted to leadership all the time, right? So it's great that you're able to get certain things done certain ways, but it's always, you need to be able to explain to them the different threats, what you're doing, how you're protecting, and also help them understand what is it that they get benefit out of it. Because at the end of the day, they have to sleep at night. I don't, but they have to. Right? So that's the reason why we help them understand that, and we make sure it works.
So at City of Hope, we're investing significantly in this particular area. From a budget standpoint, we're actually north of 7%. I don't think it's enough. In an organization that's heavily research-oriented, we have about 1,000 clinical trials going on at any one time. We're inventing a lot of interesting stuff. We need to do more in this particular space to give the researchers the freedom to do what they need to do. And if you think in terms of, where those costs are in people and tools, but also we need to look at our networks. As our networks designed appropriately to allow what we do as a business in a secure way. And so if you think of segmented networks or micro firewalls, whatever it would be, is that part of that spend? So I don't think it is, and it needs to be more. We need to rethink the way we do things today in different ways, especially in a heavily researched institution that's got scientists who want to break things, so to speak, and all the rules that we have in place don't fit. So it has to be a new model. I don't know what the right answer is, but I know that what we're doing is reinventing this entire function and trying to do it in different ways. We've got, anytime an instrument comes in, we have to go through some security process. For example, right? We've actually created a bureaucracy around this, and it's not working. We have to do something better and make it much easier on our own businesses to give them the freedom for them to operate.
Thank you.
So very similar to everybody else on the panel here, OpEx spend is probably in the 2.5–3% range. I would say that sort of having IS there at the table and kind of communicating sort of the cybersecurity culture and awareness, from the C-suite on down, some of those investments in time and explaining that is beginning to pay off. Loma Linda, we've had a CISO, but he's only been there for about 2 years. We didn't have one. We had a small group security team. Great team of guys, but they were sort of the jack-of-all-trades security people, so a lot of overlap in skill sets. And so as the threat vectors have increased and the complexities of variants and trying to get to the organization and how sophisticated that is, we're looking at the process of actually going down and how specialized these individual skill sets need to be. You might have one that's just specifically infrastructure or switches, or just through external communication. But just like at the clinical side, we have all these specialists and subspecialists. We're seeing that we're going to need part of our strategy is we're going to need to have that level of subspecialists in the security area because the threats are getting that complex.
Thank you. Adam?
Thinking about the infrastructure side, I think some of the challenges we see as we try to be more and more proactive, unfortunately we find ourselves breaking more and more, and I keep talking to Sri, he's usually the victim of that. So I think some of the things that we're challenged with when we try to get those teams to start to focus on microsegmentation or things along those lines is the challenges of working with the vendors and getting the understanding of the customer that as we add these layers of security, it adds layers of complexity, which can actually turn into, unfortunately in some cases, longer downtimes or longer implementation times.
Are anybody on the panel doing any small outsourcing of their security operations center? Are they looking at other companies to help them augment your staff? Chris?
We are. So we actually have a blended approach. It's fairly novel within an information security scenario. We've got some folks that are actually embedded at our organization. So they're not Cedars-Sinai's employees. They're the managed security services provider employees, but they're there 24/7, or they're just actually kind of like a full-time employee with my group. We include them in everything, and that's been very successful because generally when you bring in an MSSP, the difficulty is the collaboration and understanding the environment and actually taking actionable information and configuration, and then after 2 years they get a better offer and they go someplace else and you got to start over again. Right. So this scenario of actually having them embedded, we were able to get within 12 months, get it up and operational and running very efficiently, and then get the 24/7 coverage and not have to recruit as many people to West LA, which is never fun.
Good. Anybody else doing anything similar to the model?
So we are evaluating options for us to do that. There are multiple vendors who do that very well. Call Managed Security Services or Security Operations Center. There is opportunity to do that. In the healthcare market space is still, yes, evolving in that area. It will take some time for that development to happen. The financial services sector has done that very well. There are a lot of SOCs out there managed by companies like Symantec who do this for large organizations. We will get there. It's just a question of time.
We don't want to dominate all the questions, so I'd like to turn it to the audience. Are there any specific questions you have for this panel?
Where I got my vest?
No? I think we have a question.
For the question too, real quick, one thing that I've come across, and actually in May of last year, there was a report that has just come out recently from Congress, and it was actually the Healthcare Industry Cybersecurity Task Force. And they came out with a report for improving cybersecurity in the healthcare industry. It's fairly agnostic, but man, it has a lot of great tactical detail on what's going on with cybersecurity specific to healthcare and some improvement areas.
Okay, thanks, Chris. A question down here?
Steve Lance, Torres Memorial Medical Center. I have a question about your phishing campaigns. What are you doing with the information that you're capturing? Does that result in some form of counseling or training or maybe corrective action?
I wish.
We take those folks and beat them up.
Yeah.
Out to the woodshed.
Hey, I love doing that. Physicians, come on. Yeah. So it's an excellent question. We debated that very well, a lot actually. We have a CRISP committee, the Compliance, Risk and Information Security Privacy Committee. We debated that a lot. Our numbers are down. I mean, our numbers are in the double digits compared to what it was about a few years ago. So we have what you would call, you committed fraud kind of, message to let them know that. But we have people who do this time and time and again. And we track them down. We actually help them down the path. We coach them down. I should call it force them to take more training. That's, kind of slapping their fingers and say, take more training. But it's a process. It's not something that you can do and say, I'm done, right? So it goes through a process, and we've become good at it, and we're seeing a lot of benefit of doing that as well. So they understand that you're watching this, and we're helping them as well. So it's not about being punitive, but it's about education and coaching them to do the right thing. That's what changes the culture of the organization.
I think it's too also fostering a culture where they understand that it's okay to tell us if they think they did something wrong. I mean, 5 years ago, you didn't really see that. Now, especially when we do the phishing campaigns, it's really nice to have people email me and saying, hey, I clicked on this, should I have, right? And 5 years ago, you didn't see that. Nobody wanted to fess up to it. But now they actually care enough to find out, did I do something wrong so I know not to do it for the next time?
Yeah, I would second that. Before we did the phishing campaigns, I would rarely get an email questioning about a suspicious email or a link or something like that. But now it's multiple times a week I'll get an email like, I didn't click on it, should I have not? Right. Or,
is this legit?
It's nice to see that awareness is actually permeating across the organization. And we don't have the CFO sending out, an $80,000, SWIFT payment to China for dog food.
Yeah.
So. Well, the difficulty now is when you send a legitimate email correspondence, that's actually something we're really asking them truthfully. They don't want to click either, so we have to clear that up. At MemorialCare, we went through the phishing campaign, and quite honestly, we found some IT people that clicked it. They're mostly application people, so not really IT, but.
Okay, Kevin. Really, you want to say that now?
I'm glad. I just had to know the differentiation between the two. They're two different groups. Any other questions?
Yeah, over here.
We got. Go ahead. Oh.
Yeah, just a quick question. You guys are pretty intimidating with the flags behind you and your security. Let's assume they're already on the wire. They're already the bad people are already on the wire. I remember having a conversation with the CIO about 6 years ago, and he hired a firm to just not hack in, but to go out and find credentials. And the firm he hired within 48 hours came back with 5 physician credentials that worked and 2 administrator credentials that worked. I also remember a story where a clinician was actually either being blackmailed, I don't know all the details, but either being blackmailed or paid to exfiltrate data and sending it out. So let's assume they're already on the wire. What kind of things are you doing today, can we do today, knowing that they're already probably past the firewall?
Take that one?
So let's do 2 things. So let's talk about social engineering in a way, and then we'll get to the other aspect of it. So what we did, we knew this was happening because somebody would call in and say, can you give me your password, user ID, and so on and so forth, right? We actually did that. We actually had a third-party firm come in and masquerade as our help desk, call the end user and say, can you give this password, or, here's what happened. It's happened in our finance department because the finance folks have the easiest way to get them. So we called one person. It was interesting that the person was called in the morning by the third party. By afternoon, everybody in the finance department knew that there is a guy calling, don't answer the phone, right? And if he asks you, don't give him any information. And they told me that as I was walking down the elevator. They go, wait a minute, what are you talking about? I didn't know anything about it. And they said, look, there is a guy calling. Sri, you need to take care of that guy. I can't take care of the guy who's calling you. But I knew this is what was happening, right? Because we had orchestrated that function. So that's awareness that we are seeing right now. So that helps prevent the ability for somebody to do that. Now, if you take the other mechanism of what we can do surrounding information that's being penetrated from the outside, you can do penetration tests, you can do vulnerability tests, you can do other protections, firewalls, and so on and so forth. But at the end of the day, it's the guy sitting in the inside who is going to allow somebody from the outside to get inside. So if you stop the guy inside to allow somebody from the outside to get inside, that's your best protection. We've seen that happen quite a few times now for us. So the way you do this is, yes, you can have firewalls, you can have deploy, DMZs, you name it, you got all these tools and technologies. But all these tools and technologies ain't help you if the guy inside is giving out his information out to the guy on the outside. So yes, we've deployed all those technologies as well, but we also have the ability to protect it through personnel culture of security.
Yes, because you want to.
Yeah, just real quick. So there's a concept of red teams and blue teams, and the red teams are the threat actors, and they actually do scenarios where they come in and try to break in your network and pretend to be a hacker. To answer your question, the blue team is a good focus and something that a lot of folks forget. And the blue team is what Sri was saying, the folks that are actually sitting behind the consoles and the screens. And the key to that is testing capabilities in the blue team and actually saying, are these folks seeing the information? And the other piece is, are they getting the right information? So it's really kind of a coordinated approach to say, the red team comes in, they do an assessment, they find information, they find a way to get in. They're always going to get in if they're good enough. The key is to find them quickly and then efficiently deal with them as quickly as possible.
Well, thank you guys for letting us come out and talk to you. Thank you. Thank you. Thank you guys.